Hello everyone, welcome to Move Well, Live Well. We get a number of people coming in here with issues regarding their neck and what's going on with these folks. Sometimes it's not even so much their neck, they're having pain behind the eye, in and around the eye, the jaw, all in here they're having discomfort, even a headache, sometimes a headache behind the eye or in and around the temporal muscle here in the head. And sometimes they don't even complain with the neck issue. But what we're finding with these folks is, yes, they're having that pain behind the eye or behind the ear or in their jaw. And we're finding that a lot of the pain comes from the neck. Now, if you look at the neck, there's a lot of stuff going on in the neck. Yes, there's muscles in the back of the neck, but what we're finding is the muscles in the front of the neck. You're talking about the platysma, the SCM muscle, which is the sternocleidomastoid muscle, the scalenes, all these muscles kind of in the anterior portion here of the neck, the anterior lateral part of the neck. They're getting tight and they have trigger points in them. By just pushing on them, by just putting pressure on them, they're getting referred pain behind the eye, the temporal portion of their head, sometimes behind the ear, and even the jaw. And so the eye pain, the jaw pain, and those types of pains and headaches are coming from here. So how do you fix that stuff? How do you change these neck muscles in the front and anterior lateral part of the neck so that way you don't get those issues? Well, let's face it, again, we sit way too much. And we're always in this kind of, you're at the computer all day long, you're in here, and now your head just kind of follows as your shoulders do this. And you're reading and whatever it may be, and you get this forward neck. So these guys get tight on a chronic basis. Or we even have folks that fall asleep. They fall asleep and their neck, they're on the couch or something like that, and their neck's like this. Or they fall asleep at the headboard, right? They fall asleep at the headboard of their bed, and they're like this. And then they wake up with stiff neck all here in the front. So those guys are chronically shortened for long periods of time. And then they wake up with headache, eye pain, and jaw pain. It's all coming from this front part of the neck. So how do you fix that? Take a good old handy dandy lacrosse ball. I recommend a lacrosse ball or any kind of ball that it's a rubber coating helps really well with this. The lacrosse ball is great simply because they're very durable. You can take them anywhere, and with the rubber composition of it, it helps to hold the skin a lot better. It doesn't slide around your skin as much. So if you have, remember you have your skin, the adipose tissue, and the fascia and the muscle all layered together, and if those layers have become matted down, kind of like, if you don't know if you've ever seen a matted hair on a pet of yours or whatever, all the fibers are kind of haphazardly laid down, and that's kind of what these tissues, all these adhesions between the tissues, it doesn't let the tissues glide as well as they should, and the nerves getting trapped in there, and you get trigger points, and you get referred pain going in all these different places on your head, and giving you headaches and eye pain and all kinds of stuff, jaw pain. So, good old handy dandy lacrosse ball. You take this sucker, and you search around, find those tender spots, like right there. That's a little tender for me. And then what you want to do is you want to push into the tender spot a little bit, and then twist. See that? You twist a little bit to take the tissue slack out, and then you go into your neck stretches. And this is much more effective than just simply doing these. I mean, yeah, you can do these when you don't have a lacrosse ball around. You can do these. These are great to open up the muscles of the neck. So if you want to stretch the right side here of my neck, I tilt my head to the left, and it just opens that up. And I can turn my head in different ways, and you get a good stretch that way. But having this on top of that, so you tack down, so you push in, a little bit of pressure, and then you rotate a little bit, you twist it, and now you go into your neck stretches. And man, you can really feel the difference in that stretch, you're breaking up those adhesions in there. And sometimes you can even feel the referred pain into the back of your eye, your forehead. You can feel them, in the temporal region, even into the jaw as you go through like for instance, the SCM here, right? Get the SCM in here, you get the scalenes in through here in the platysma, right? Just above the collarbone. See, this is my collarbone right here, right? So just above the collarbone, going right there. Oh man, there's some tight junk in here. Twist and then rotate. Oh man, tilt your head back. So I'm tilting my head back a little bit, rotating a little bit. Oh man, that's a good one. Whew. Because even me, I have a tendency, hanging out at home or something like that. You're watching a show, whatever it may be. You're watching some Move Well, Live Well vids. And you're not doing what the video is trying to demonstrate. You're just sitting there watching it. And you end up sitting like this. Like your head against the headboard, and these guys get tacked down. So you're ungluing, right there. These are the scalenes right here. They attach to the first and second ribs right there. And that's a good one right there. And you're just finding those tight spots by rotating the head around in different directions. And you work your way up. Keep finding those spots. Like there's another spot right there. Again, tack it down. And then twist a little bit. Oh man, that's a good one. Ooh, right in there. And this one, I can feel it go up kind of like behind the ear a little bit into the jaw. So again, scalenes, right? Scalenes just above the collarbone here. The SCM, again, sternocleidomastoid, you can kind of see it. I don't know if you can kind of see that. Sternum, clavicle, mastoid. So it goes all the way to the mastoid process here. You can even go up in here. See that mastoid attaches to behind the ear a little bit. So here's your ear. That mastoid process is right here. You can go just below that. Oh man, tack that sucker down, twist. Right there. And tilt your head to the side. Oh my gosh. Ooh. Yeah. And it's a lot more effective. If you want, you can add a little overpressure with your hand, but this is a lot more effective than simply stretching. Don't get me wrong, stretches, if you don't have this, is great. But get this sucker in here. Find that. See, there's the SCM, there's the mastoid process is right here on the back of my ear. And I can pretty much go down this entire muscle. You can kind of feel all that in there. Oh, that's a good one. Man, and taking all different directions there to get alleviation of those problems in the anterior lateral part of the neck. By freeing these guys up, you're going to minimize the amount of pain behind the eye, the headaches, the jaw pain, all that stuff to fix, those times when you fall asleep like this, up against the headboard or on the couch, or also all the bunch of times where we're texting and doing that with our neck. These muscles get super tight in here, giving us all kinds of problems. Anyway, we thank you for watching. We appreciate it. If you have any questions with this video, drop them off in the comment section below. And if you're new to this channel, go ahead and hit subscribe. And then when you hit subscribe, make sure you hit that bell notifications button. And that way you don't miss any videos coming up here in the near future. And you get to know what's going on here at Move Well, Live Well. And you can continue to move well, live well. And also, give us a like. Give us a thumbs up. It lets us know you care. Anyway, we thank you for watching. We appreciate it. Also, share this with others so that way they can benefit from these videos, and that I know you know some people who have headaches and jaw pain and pain behind the ears and all kinds of stuff. And don't tell me you don't. I know you guys, on your devices a lot. Getting that problems with the front of the neck, that type of thing, giving you all kinds of problems. So share it with those guys. Anyway, again, we thank you for watching. We appreciate it. We'll see you next time. Take care.